Global Armen Health Educator Mike. It's unfortunate we are starting at this time after 10 a.m. Right, this is about 9 or 10 minutes after 10. So it's unfortunate that we are starting at this time. It's actually because of power supply issues, but we still want to mark present for today's live streaming, and that information that you actually need to always receive it on this channel. So that's why I said we must stream today to just communicate the information at once. As you all know, this is Healthy Living Global, and it's a channel that is always committed to health tips, health promotion, disease prevention. We bring you updates when it comes to maintenance of your health in general. So that's what we do here, and that's what we stand for. Healthy Living Global, taking the healthy life to a global scale. All right, all of us need to actually live healthy, and we can achieve that by making constant efforts to see that it is achieved by obeying the necessary guidelines that have been given to us, following it strictly with all sense of commitment, right, to achieve that particular goal. So yesterday wanted to explain one or two things about kidney failure, the risk factors, but unfortunately there was a network glitch that had to cut off the discussion. So today we are going to make it very brief because of the power supply issue. So just to hit the nail on the head about kidney failure. So kidney failure, of course, if your kidney fail to function, the next option is to go on dialysis. Of course, dialysis is not cheap. Dialysis is very expensive, and in fact, it complicates your health the more, because other things is it you cannot just compare it with normal process of urine formation or normal process that the kidney uses to clean the body, right? Make sure that it passes what waste product through urine away from the body. So you cannot compare it with dialysis. Dialysis will always give more side effects and have more negative reactions, but that of normal process of kidney, healthy kidney, is the best. So now we say that as some certain illness or health conditions or disease that you may have in your body, that are risk factors of this kidney failure, all right, that can bring about this kidney failure. And we started by mentioning that number one is diabetes. Of course, the diabetes, when you have high level of sugar in your blood, is going to destroy um, the blood vessels and even the nerves, all right, of those um, part of the kidney that is filtering the blood, like the nephrons, right? So it will destroy that particular part, making your kidney to fail. And once your kidney fail, you go for dialysis that is not cheap. Now the next thing is hypertension, and I explained yesterday that all these chronic non-communicable diseases, sometimes they are interrelated, right? This one can result to this one can cause this, so they are just related somehow, all right? Because you have diabetes, it can lead you to having hypertension because of what weakened blood vessel, right? If you have hypertension, it can make you to develop hyperlipidemia, it can make you to have chronic kidney disease, right? So all those things, they are just linked to each other, and we need to know them and prevent them. So the next thing I will mention yesterday was um hypertension. No, if you're having hypertension, of course, it can destroy the blood vessels. It can lead to the inflammation or irritation of the blood vessels in that kidney. And when that happens, it happens over time for a very long period of time, especially chronic hypertension. It can lead to kidney failure. And once your kidney fails, you go for dialysis. Then the next thing we mentioned is what chronic kidney disease, like you are having hepatitis, um, having alcohol, liver disease, liver cirrhosis, all those chronic kidney disease. All right. That is if you're having chronic kidney disease, or you're having a even issue with liver. All right. All those things. That's why I say they are somehow interrelated. If you're having uh, these liver issues, right, it can still give you a problem in that of your kidney. When once your liver is degenerating as a result of let's say all these hepatitis, all these alcoholic liver disease, even liver cirrhosis, all right, it can still it kind of fall back, because once the organ is not functioning properly, it can fall back to that of kidney, because the kidney also will not function properly. So if you're having a chronic kidney disease, right, chronic kidney disease that have lasted for a very long period of time, of course it can lead to this kidney failure. All right, can lead to kidney failure. So we started by what mentioning liver diseases, right, like hepatitis, alcoholic liver disease, liver cirrhosis. So when the liver degenerate in that way, the kidney also may not function properly. And once you have that chronic kidney disease as a result of that liver issues and so on, it can lead to um, this kidney failure. And once your kidney fails, right, you see that um, you must go for what dialysis, right? So we have kidney failure and we have also liver failure. Don't forget, we have also liver failure, which I have to make a little emphasis on that of liver and the illnesses of which can lead to that liver disease or issues. Now, outside that chronic kidney disease as one of the cause of kidney failure, one of the risk factor of kidney failure. The next thing we're going to mention is family history. Of course, if you have a family history of this kidney disease, or maybe kidney failure, right, your parent or in your lineage someone have had this kidney failure that resulted to dialysis, it's actually important you go for a regular diagnosis when it comes to this kidney issue, to make sure that you don't develop any kidney disease that may lead to kidney failure, because sometimes it runs in family. Now, next thing we will discuss is old age. Of course, if you are above 65 years, there's every possibility that your kidney must have overworked itself, and at that particular stage, um, it may not function properly, especially in that of male. So it's very easy for them to develop kidney failure. And once you develop kidney failure, the next thing is what? Dialysis, and dialysis is not cheap. Now, we have even heart disease, right? Other heart disease aside hypertension can also lead to this kidney failure. All right, even autoimmune disease, that sometimes the immune system will begin to fight the kidney. All right, we begin to fight the kidney, destroying the nephrons, right, that helps in filtering the blood. And what will happen once the nephrons is destroyed, it will lead to kidney failure. And once you have this kidney failure, the next thing is for you to go for dialysis. Now we have even prostate, all right, issue, and that of a kidney stone. All right, when this thing is in your body over time, all the kidney stone, there's obstruction, all right, to this filtration process in your kidney. All right, when you have it over time for many years, it will reach a time it will destroy that filtering process in the kidney. It will lead to what? Kidney failure. It will make the kidney to fail, because of what? The whole processes that were taking place in that kidney is no longer happening as before. So once it destroy the kidney, all right, due to these obstructions, all right, in the kidney, of course the kidney can fail. Right, if you have a blockage, please take note of this. By kidney failing, I didn't mean that kidney have deteriorated, or it must be infected, right? Or it must have bacterial infection or something. With this kidney stone idea, it might interest you to know that if there is a blockage, right, blockage with this kidney stone, if there is a blockage in that filtration, in the nephrons and in the other part that helps in filtering the blood, if there is a blockage, of course the kidney will fail. There won't be a passage of all those urine that will be filtered out of the body. All right, there won't be a passage for them, and once it's blocked, your kidney have failed. And the next thing you must do is to go what on dialysis before they begin to talk about surgical procedure to correct that anomaly. Right, so it's actually important that you go for what regular checkups when it comes to your kidney. Make sure you take care of your kidney. Of course, you don't have you have two kidney, even though one can still function, all right, even if you don't have the two. But if the two become destroyed, if the two is totally destroyed, there is nothing of which you can do. It's either you go on dialysis or you meet your creator. So that is how the thing is. So please take care of your kidney by taking enough water that will help and flush any electrolyte that may result to maybe solidify into in solid form, bringing about kidney stone. Take enough water that will flush it out, all right, make it to urinate as expected, and do not hold urine, all right, do not hold urine. All those things causes problem in the kidney and even in your blood and urinary system. So do not hold urine. Make sure you urinate often, and also rehydrate yourself as expected, so that you don't develop any of these kidney stone. And also you take care of your kidney by avoiding one of all these infection cases, and even taking care of your liver. It will still in the end be a support to your kidney. So you need to do your own part and leave the rest. So I mentioned the risk factors. If you have any condition, right, of that we have mentioned now, all right, all these conditions like hypertension, diabetes, maybe you are having you are old, all right, old age, or you are in a family history that have this kidney failure, or you have a chronic kidney disease, all right, that have lasted for a long period of time, you must seek medical help at once, because failure to do that, it can lead to what kidney failure. And once your kidney fails, is very difficult. Some of them anyway can be reversed, especially that of kidney stone, right? It can be reversed, but in so many cases it may not be reversed anymore. So you need to seek medical help on time, so that something will be done about that to correct that abnormality. So that's what you need to do to keep your kidney healthy, to keep your kidney functional, because that is what the body utilizes to do the whole filtration process. There are many things that takes place, ultrafiltration, selective reabsorption, and other many processes takes place before urine is formed, right? And if your kidney is not there to follow up on all those processes, to come to Bowman capsule, to go to the other one from nephron to this, all those processes is what takes place in your kidney before urine is formed. But if your kidney is not there, using the artificial method, which is this dialysis, of course it can lead to irritation of the cells in your system, all right. So it's just like you can't compare artificial, all right, with something that is natural. Of course you cannot compare the two. So the other one is just a man-made processes of cleaning the body or filtering the blood to make sure that you remove the waste product through urine. But the other one is natural method. So go for natural method. Do anything you can within your limit to make sure that you want to protect your kidney dearly, right? So that you won't be you won't have anything like kidney failure in life. All right, don't develop into like kidney failure. So if you have any of these health condition, seek medical help at once, manage it properly. It doesn't develop in one day. It's a gradual process. You have hypertension, you are managing it. You think maybe you are tired of managing. Someone that I know, one of my clients came to me, we check the blood pressure. The blood pressure was very high. I say, okay, this is what you do. You can go for use this medicine, but be checking it often. You check one day and discover that it's coming down a bit. Check the second day, it's coming down a bit. The third day, it didn't come down again. It's still the same with that of the previous day. And he got angry. He said, I'm not even checking again. You don't need to get angry with anyone. All right, you need to actually do your own part, because when it will hit you, it's not me that is going to hit. So I'm just there to provide information that you need, the encouragement you need, the advice you need, right, to stay healthy and improve your health. You don't need to be angry with anyone, because once the thing hits you, all right, you know that something have happened, right? BP is dangerous, and when you manage it, other complications that you may have as a result of that BP will go away. Let me still repeat. I say all these chronic kidney chronic non-communicable diseases, they are interrelated. This one can cause this one can cause this one can cause it, can result to this. That is how they are related. If you have kidney disease, all right, over time, it can make you to develop another non-communicable disease. If you have hypertension, it can make you to develop another non-communicable disease. If you have high sugar level, which is diabetes, that diabetes mellitus, all right, so it can still make you to develop another non-communicable disease. That's how they are interrelated. So please guys, share the link of this live streaming to groups where you belong to and your family members that would want them to benefit from this live streaming. And see you guys tomorrow for another health tips on this channel. We're not backing down, we're not going on holiday. We must answer present any day with a health tip that is going to help you strike your mind and uplift you and help you to live a healthier life. That's what we do on this particular channel. And see you guys tomorrow. Once you have any question, put it in the comment section. Once I receive the notification of the question, I will answer it at once, right? Let us get things right. We just discussed about risk factors of kidney failure, all right, and we related it to many things. We related to hypertension, diabetes, that of chronic kidney diseases. We related it to old age and even family history, heart disease, autoimmune disease, prostate, and even kidney stone, all right, as the risk factor. So please take note of this and make sure you prevent all these conditions. If you don't have it already, and if you have it, seek medical help so that it will be treated at once. Thank you, and see you guys tomorrow.